And, well, for years we have known that not smoking and eating right can add years to your life. But should we all live like Olympic athletes to slow down the ageing process?
We all need some exercise, but what sort will increase your lifespan and keep your body at its best? Dr. Bob Goldman heads up the World Academy for Anti-Aging Medicine. He's visiting Australia from the US. He is the guru around the world for anti-aging. Good morning to you. Now, is this really common sense that if you don't keep moving as you age, you're just going to deteriorate?
Yeah, it's very important. It's either use it or lose it. I'm out here for the Australasian Academy of Anti-Aging Medicine International Conference, and we're training and educating physicians and health professionals as to how to help people to get in the best shape they can for the rest of their lives.
Okay, how much do we have to move? We have been told in previous years 30 minutes of exercise or a walk maybe 3 times a week.
Well, it really comes down to consistency, and I think, if you can get some good aerobic exercise three or more times a week and maybe some strength training to maintain your muscle mass, these are good ways to begin a program.
Okay, so it's not just a walk in the park. You actually got to put some effort, do proper cardio and also a few weights.
Absolutely. I think it's a comprehensive program. It's all about the prevention of disease, and that's what's so great about your federal government now is just form an agency for preventative health care. And this is critical in order to keep the health of the nation strong.
How many weights? Because a lot of people who don't do them or haven't done them in the past would be afraid to do weights.
Well, no one really needs to be afraid of weights. It's how much you use, how often, and how hard you train. You can just lift lightly, and you're able to increase your muscle mass, your bone mass. It really is an important part of training.
Okay, a few other things you say is drink purified water to de-stress and detox, modify your diet, but also you say take vitamin pills as well. What sort should we be taking?
Well, there's only so much you can get from foods. In order to take the anti-aging levels of vitamin C, you'd have to eat 30 oranges, and you can't really do that every day. So taking a pill of vitamin C, B complex, vitamin D is catching the attention of the scientific community, fish oils. These are some very simple things you can do that are inexpensive and able to keep you on a good program.
Okay, you've set a lot of sports records in the past. How do you keep active now?
Well, I like to, because I travel, I also run the International Medical Commission. I'm overseeing sports medicine groups in over 180 countries. The first thing I do as soon as I touch down is I like to lift weights and do some aerobic training, and I try to do this at least 5 days per week, depending which part of the world I'm in.
Okay, you mentioned before the federal government is investigating more preventative health measures. What should they be looking at? What advice would you give them in this program?
Well, we put together a 12-point action plan in America, which we presented to our government, and now the Australasian Academy of Anti-Aging Medicine is presenting that to your government. And it's all about education, being proactive, getting the patients involved with their healthcare professionals, really good common sense to know what to do and then implement it.
Okay. Dr. Bob Goldman, good luck with the conference this week, and thanks very much for joining us on Sunrise.
Thank you. Pleasure.
Okay, drink a lot of water, keep active, but not just walking, a bit more than walking, get the heart rate going, and a few weights.
Even if they're light weights. Yeah, there you go.
Shortly on the morning show, the most controversial celebrity mums.
But after the break, Tim Finn with one of his classic songs. He's performing live when we return.